Have you ever wondered the difference between a urinary tract infection and a sexually transmitted infection? The difference between UTI and STI or STD. In this video, I'm going to be demystifying urinary tract infections and sexually transmitted diseases for you. And if you are new to this channel, my name is Pharmacist Marvelene, and from time to time, I share helpful videos here. Every Mondays, I share beauty and lifestyle content. Every Wednesdays, I share skill acquisition and do-it-yourself videos. And every Friday, I share pharmacy gist and health tips. In today's video, I'm going to be sharing the difference between sexually transmitted infections and urinary tract infections, and the truth about toilet infection. So you would come up and hear so many things about I'm having toilet infection and all that. But today I'm going to be telling you the truth about urinary tract infections and sexually transmitted diseases. First of all, a urinary tract infection is an infection of either the bladder, the kidneys, the urethra, or the ureter. An infection of the bladder, the urethra, the ureter, or the kidneys. The kidneys are those organs in the body that are responsible for the excretion of urine. They are responsible for the production and the excretion of urine in the body. These are the details of the kidney. The next thing I want you to know is that the bladder is the part of the urinary system, the excretory system in the body that holds the urine until it's time for the urine to be released. So if that bladder is infected by these diseases, you could have a urinary tract infection. The ureter are the tubes that connect the kidneys to the bladder. The urethra is the tube that connects the ureter to the external environment. If any of these parts are infected, you would have a urinary tract infection. The symptoms of urinary tract infections vary in male and female. They range from abdominal pain to the urge to urinate even when you have already urinated, cloudy urine, low-grade fever, trouble urinating. And these infections of the urinary system, which are the urinary tract infections, are mostly caused by Escherichia coli bacteria, that's the E. coli. And it can be diagnosed by a urine microscopy culture and sensitivity test or a urinalysis. And there are different medications that can help. But lifestyle tips include ensuring that your clothes are well dried, your underwears are well dried in the sun. And also, you should boost your intake of vitamin C. You could take cranberry juice or probiotics. And it's important that if symptoms persist, please consult your healthcare provider for the best recommendation. Cranberry juice, vitamin C, probiotics are helpful to balance the pH and destroy the harmful bacteria. Usually, urinary tract infections are caused by Escherichia coli. Then for sexually transmitted infections are mostly transmitted during sex. It could be candidiasis, it could be trichomoniasis, that's Trichomonas vaginalis, caused by fungi. It could be the Staphylococcus overgrowth, that's the Staphylococcus aureus. All of this, the important thing is that all of these microorganisms are there outside to balance the environment, the normal flora of the body. But what happens is when there is an overgrowth, sexually transmitted infections like gonorrhea, like chlamydia, like syphilis are those infections that are transmitted through sexual intercourse. This could be through oral sex, skin to skin, vaginal sex, anal sex, coming in contact with people who have vaginal warts or herpes, sharing of towels, sharing of clothes, sharing of underwears, maybe blisters or injuries. So if you're having vigorous sex and one of the partners gets injured, if the other partner is infected, that could be a means of spreading the sexually transmitted infection. And the common symptoms of sexually transmitted infection are dysuria, that's painful urination, cloudy urine or dark urine, itching, as well as blisters or even injury. So the infections, either sexually transmitted or urinary tract infections, are mostly infections of the reproductive system or the excretory system. But the difference is that for urinary tract infections, either the bladder, the urethra, or the kidneys are involved, while for the sexually transmitted infections, it's mostly during sex, which involves still the organs of the body, right? The penis, the vagina, the female reproductive system in general and the male reproductive system in general. And it's important to note that it's mostly as a result of unprotected sex with an infected partner. And sometimes the symptoms mimic each other, and that's why it's commonly misdiagnosed. And the only way to really know what is by carrying out a microscopic culture and sensitivity test or a blood test to know. And it's important that even when you are faithful to your partner or you are abstaining, you carry out these laboratory investigations to ascertain that you do not have any infection before you have unprotected sex. But the surest and the best way is always to protect yourself by using a condom, because condoms have 94% protection against sexually transmitted infections and also have the capacity to prevent pregnancy. So why not play safe? Thank you so much for coming around to know the difference between urinary tract infections and sexually transmitted infections or sexually transmitted diseases. The likes of hepatitis, the likes of HIV, there are several sexually transmitted diseases, but the difference is just that sexually transmitted diseases are transmitted during sex and can be passed from partner to partner. And for males, these infections can stay as long as in their bodies before they begin to show symptoms, because most of these sexually transmitted infections or urinary tract infections are asymptomatic. And that is why it's important that you go to the healthcare facility closest to you, consult your doctor, consult your pharmacist on the right medications to take, and you will just be fine. And like I said, play safe. Thank you so much.